Liposuction is a procedure where fat is sucked out of the body. It has other names like body sculpture, liposculpture and all sorts of other names, but essentially it's just sucking out fat. Liposuction can be performed on almost everywhere on the human body, but the classic indications are from top to bottom, liposuction of the chin, liposuction of the upper arms, liposuction of the male chest, liposuction of the tummy, liposuction of the flanks, liposuction of the buttocks, and liposuction of the thighs. It's rare that we perform liposuction to the knees or the calves or the ankles because that is quite risky because of sweat. A good candidate for liposuction is a person who has a healthy diet, has lost weight but finds it difficult to lose the last bits of fat. The bad candidate is a person who seeks liposuction for losing body weight. Fat is not very heavy and therefore a loss of body weight is not expected with liposuction. It is also important that this patient has realistic expectations of the surgery, and liposuction on its own is not going to yield the best results. You also have to be very aware of your diet and your exercise regime. The risks involved with liposuction are very minimal, although there are risks involved. Infection is extremely rare, bleedings, hematomas is extremely rare. The biggest risk really with liposuction is asymmetry. If you work on two sides of the body, you have to make sure you take equal amounts of fat out in the right places on each side of the body, and that can sometimes be difficult. Normally we can do this as a day case, but quite often people travel from far to the surgery and we can accommodate them for a night, although this is not strictly necessary. The time after liposuction that you can go back to work and resume normal life really depends a little bit on the extent of the operation. If it's a localized area, a lot of people go back to work the next day or 2 days after. If it is extensive liposuction, it is advised to take a week of work. Normally the liposuction can be done as a day case. It is rare that people stay overnight. The best indication for liposuction is localized fat areas. The classic indication being what we call saddlebag deformity. And what liposuction can achieve is a restoration of a better body contour, for example in the flanks or on the legs.